Hey everybody, welcome to my first official medical information video. And so this video is titled What is blood pressure and why do we care? Blood pressure is a very basic thing in medicine, in primary care, something that we check on everybody every single time they come in, and is very frequently something we're dealing with. And I oftentimes find myself talking to patients about why do we care so much? So here we go. What is blood pressure and why do we care? Very simply, blood pressure is the amount of pressure that the blood puts on the artery walls that's inside our arteries. I brought here a prop. I have a balloon with some water in it to kind of demonstrate a little bit about this. And so you imagine our arteries are actually fairly like water balloons. They're stretchy. They can stretch and bound as the blood pulses through them. That's why you can feel a pulse on your wrist or your carotid pulse, because as the blood rushes through with every heartbeat, the artery stretches around it. And so blood pressure is the amount of pressure that the blood is pushing on those walls. We have the two blood pressures, systolic, which is the top number, diastolic, the bottom number. Those are the pressures that the blood is exerting both during contraction and relaxation. So if you take the water balloon, if this is an artery, it has the blood in it, the heart contracts, high pressure. There's a lot of pressure right now. It relaxes, less pressure. Systolic blood pressure, diastolic blood pressure. Top number, bottom number. So when we're checking the blood pressure, we're putting a cuff on the arm. We're running that pressure up until it completely seals off the artery. So as the heart pumps, no blood gets through, because the pressure in the cuff is higher than the pressure of the blood pushing out in the arteries. So let's say we run it up to 200, no blood's getting through, we don't hear anything. As we let the pressure out of that cuff, down to 190, down to 180, down to 170, eventually we're going to get to a point where at maximum contraction, the blood is able to squeeze through the pinch of the cuff. Once we get to that point where maximum contraction is able to put blood through, the pressure in that cuff is then equal to the top number. So we come down to 160, 150, let's say we get down to 140, and then at 135 you hear a in your stethoscope or a little thud. That's because the blood's able to squirt through now. So that's the top number, the amount of pressure that the blood is pushing out at maximum contraction, 135, systolic blood pressure. You keep going, you hear it with each heartbeat. Pressure's going down in the cuff, down to 100, down to 90, down to 80, and let's say at 75, all of a sudden you stop hearing anything. That's because the pressure's no longer exerting anything on the artery. The blood is just running through nice and smooth. You stop hearing each pulse. So that's the bottom number. So systolic blood pressure, top number, maximum pressure because of the heart contraction. Diastolic, bottom number, pressure when the heart's not contracting. So that's what blood pressure is. Now, why does it matter? Why do we care? And the answer is because a high blood pressure damages the inside of the arteries little by little over years of time. So I oftentimes tell patients that blood pressure, unless it's really high, isn't going to hurt you right now. It's not going to cause something, like I said, unless it's super high at the moment. But what happens is you have the blood that's inside those arteries. If the pressure is high, that is exerting a lot of pressure on the inside of the artery wall. The blood is rushing through with a high amount of pressure, and it damages those delicate cells on the inside of the artery. Now, just like if I were to cut my hand, that cut would heal, but there would be a scar. And that scar tissue is stiffer than regular skin. Same thing happens inside the arteries. You have a high blood pressure. Let's say your blood pressure runs at 150 over 90 all the time. That's higher than normal. Blood pressure, the blood is rushing through at a high pressure, it's damaging and healing, damaging and healing. But every time it heals, it's a little more stiff. So when you're young and healthy, you have nice water balloon arteries, where when the heart contracts, it's able to stretch, contract and stretch. But if you have high blood pressure over time, you're damaging and repairing, and your arteries are going from nice stretchy water balloons to more and more like they're lead pipes. And so then you're 60 years old, you're 70 years old, and you've got narrow lead pipe arteries. The blood's going through, but if you get some cholesterol in there, you get a blood clot coming through, you can't stretch around it anymore. You get a blockage, and whatever's downstream doesn't get blood. If it's the heart, that's a heart attack. If it's the brain, then that's a stroke. And so 20 years of high blood pressure increases your risk of having a heart attack or having a stroke in the future. You don't feel anything right now with your blood pressure high. Most people don't. Some have symptoms, but not usually. But you're wearing your vessels down. You're making them more and more stiff. You're increasing your chance of having problems in the future. So if we bring that blood pressure down by having a healthy diet, regular exercise, and yes, sometimes medications, we can prevent that damage. We can keep our arteries nice and stretchy, and we can prevent problems in the future. So that's what blood pressure is. That's why it matters. I hope you have a good day.